Imagine being barely able to breathe, where every breath is a struggle. Well, that's what many with serious lung conditions like emphysema go through every day. But now, thanks to a new procedure, there's hope for a much improved quality of life.
These patients are so out of breath. You know, it's like if you or I were to take a very deep breath and then try and breathe up there all the time.
The extreme shortness of breath is caused when air gets trapped in parts of the lung that's damaged by emphysema, a progressive and life-threatening disease. Well, now patients can actually breathe a sigh of relief with the recent FDA approval of the Zephyr endobronchial valve treatment. It's a breakthrough procedure that will help patients be less short of breath and more active.
They may even come off their oxygen. Some patients may even fall off the lung transplant list because they do so well.
Currently, there's nothing like this out there, and it's only being performed by doctors at Eisenhower Health, headed up by pulmonary and critical care physician Justin Thomas, who explains that the procedure begins with a very small valve that gets inserted into the airway.
It's made out of a metal called nitinol that's self-expanding, and it also is made of silicone. So the silicone forms a little valve that allows the air to just escape out of the lung, but not go back in that portion of lung that we treat.
Enabling the patient to get improved lung function. A minimally invasive procedure, doctors can place anywhere from 3 to 5 valves per treatment using a small scope that goes down through the patient's airway. The alternative is major surgery,
where they go in, surgeons go in and cut out parts of the upper lobes of the lung.
This 20-minute procedure, the doctor says, is a game changer, and he cites a landmark trial
that showed an 18% on average improvement in lung function, which is huge.
The Zephyr valve procedure has no age limit, and it is covered by most insurance. I'm Janet Zapala for Your Health Matters.